Just 1 week after hearing about Pfizer's exciting vaccine trial results, we're now hearing that Moderna's vaccine is 94.5% effective at reducing symptomatic cases of coronavirus. So stick around and we'll talk about the details. I'm Dr. Rachel Johns, an internal medicine doctor specializing in hospital-based medicine out of Southern California. I'm a frontline physician and I've been taking care of coronavirus patients since the very beginning. I'm here to bring you the latest on scientific information so that you can live your best life. So please subscribe to my channel so you don't miss any of these important updates. Moderna has been working with the NIH, the National Institute of Health, and the U.S. Department of Health and Human Services to enroll over 30,000 clinical participants in their study in the United States. They have previously said that their vaccine produces super high antibody levels, higher than in patients who have actually had coronavirus. So at this point in their trial, they've had 95 symptomatic cases of coronavirus. 90 have been in the placebo group and only 5 in the vaccine group. So that is a huge difference. They have reached the primary endpoint of their clinical trial, the number of symptomatic cases of coronavirus. What I find even more interesting is the secondary endpoint, which is the number of severe cases of coronavirus. These are the cases that land you in the hospital, in the ICU, on a ventilator, maybe even dying. So in their trial so far, they've had 11 of those 95 cases be classified as severe, and none of them were in the vaccine group. So this is the true value of vaccines. The point of the vaccine is to get your immune system primed to fight the virus. So let's talk about the flu virus for one. So when you get your flu shot every year, you're priming your body to produce antibodies against that seasonal flu that's going to be going around. So if you come into contact with it, you might get infected, but your body is already ready to fight it. So your case is going to be very mild. And what it does is it prevents severe cases, it prevents complications, and it prevents flu deaths. It's not 100%, but that is the true point of the vaccine. So what we really want from the COVID vaccine is to prevent people from being in the hospital, being on ventilators, and to prevent the complications like this post-viral syndrome that we're now finding called long haulers, where patients who are recovering from COVID are not really recovering. They're having months and months of shortness of breath and overwhelming fatigue, and these are young people that are becoming disabled. And so those are the kinds of things that we want to prevent with a vaccine. So who are these clinical participants? 23% of them are over the age of 65. 42% are in high-risk medical groups. These are patients with diabetes, severe obesity, and heart disease. And 37% are from communities of color. Groups that are not represented are children and pregnant women, which are pretty common to be excluded from any clinical trial. The Moderna vaccine is fairly well tolerated. You're going to get the sore arm and maybe some redness around the injection site. Some people are also complaining of muscle aches and headaches, similar to the Pfizer vaccine, but it's nothing you can't handle, and it's a lot better than getting coronavirus. What they have not seen are any severe side effects from their vaccine, which is really fantastic. What we know from other vaccines is that we see severe side effects coming within the first 6 weeks after the vaccine was given. So they are going to wait for a full 2 months after the second dose before they file for FDA approval, which should be coming by the end of November. So they have to prove to the FDA that their vaccine is safe and it's effective, and that they can produce this safe and effective vaccine in mass production. So Moderna is on track to produce 20 million doses by the end of this calendar year. Remember that it's a 2-dose vaccine and it's spaced 28 days apart. So we can start vaccinating 10 million people by the end of this calendar year and 500 million people by the end of 2021. The logistics of distribution for Moderna vaccine is going to be a lot easier. Pfizer's vaccine has to be kept super cold, like South Pole on a winter day cold. Moderna's vaccine can be kept in a standard refrigerator for 30 days before it goes bad, and you can actually take it out and keep it at room temperature for 12 hours before administering the vaccine. So that is a lot easier. So even though these are very early study results, the fact that both Pfizer and Moderna, who are using the same technology and coming up with the same results, is really exciting. So that makes both of their studies even that much stronger. So both Pfizer and Moderna are using mRNA. This is a technology that has not been used in a vaccine before, but the science behind it is really interesting. The M in mRNA stands for messenger. Think of it like a blueprint or a recipe. So they're injecting you with this genetic material that is going to go into your cells and tell your cells to produce the spike protein that you see on the outside of the COVID virus. And then that spike protein gets released in your body, and then your body produces antibodies against it. So unlike the vaccines that we have right now, which are inactivated virus or viral particles, this is genetic material that is using your body to produce the spike proteins and not the whole virus itself. So I find that pretty interesting. If you found this video interesting, please give it a like. Please subscribe to my channel. I have a lot more information coming up for you on vaccines and testing. I'm Dr. Rachel Johns, and I'll see you in the next video.